WHO sees teachers as playing an irreplaceable role in children's lives, first in their physical, mental, and social health, and subsequently in their capacity to live well and contribute to society through their life course. You're on the front lines of the response to ensure that learning continues for nearly 1.5 billion students. Today, in the time of the worst pandemic the world has seen in 100 years, we in the international community recognize the importance of safeguarding the right to education. And that means taking all measures possible to protect both students and teachers against the risk of being infected with the virus that causes COVID-19. The pandemic has taught us who society's essential workers are. Health workers, who are the custodians of our physical and mental health and well-being. Teachers and education workers, who are the guardians of our most precious investment. The children, who are the promise of our collective future. We owe teachers the conditions, the resources, the pay, the training, the support, and the respect they deserve. Most importantly, we owe educators our patience, understanding, and solidarity. Long-term school closures may have severe negative impact on children's health and well-being and on their educational progress. Now, many schools have taken measures to reopen safely. Recently, WHO, together with UNESCO and UNICEF, published considerations for school-related public health measures in the context of COVID-19. This document looks at school operations, including openings, closures, and reopenings, and the measures needed to minimize the risk to students and staff of illness with COVID-19. We hope it will prove to be useful for decision makers in your countries. Schools are more than places for children to learn. For many millions of children, it's the place where they receive nourishing meals, maybe the one meal they need per day, opportunities for physical activity and important health services, including immunization. For many, it's the main place they learn about health and staying healthy. Schools are places where students develop behaviors and habits they carry into adulthood. In the context of COVID-19, schools can help provide sound guidance to children and their families, prevent the spread of misinformation, and put fears into perspective. They can also promote important behaviors such as hand hygiene and respiratory etiquette. Reopening schools enables these supportive interventions to be renewed. It also provides a welcome environment for teachers to provide evidence-based, age and curriculum appropriate information about COVID-19 to children and young people, to promote coping mechanisms and identify stress, and to encourage children to ask questions. We hope a positive outcome of this terrible virus will be to encourage young people to consider studying to become health workers and teachers, where we have plenty of jobs waiting.